So it was in 1991, we were in Pueblo, and the opportunity to come to Salud lent itself. And I thought about it, and I really thought it was a really good idea, just because being a product of the movement and being engaged in social change, what has always been important to me has been the idea of increasing my sphere of influence. Not for me individually, but for the message. I consider myself nothing but a messenger for a movement in terms of social justice and equality and health care for all. And that's been my expression as a product of the movement in terms of what I've done. So the larger that sphere of influence, the more lives, the more people, the larger the impact one will have. And I realized that coming to Salud was a much larger system than what we had in Pueblo. The director at that time, Jerry Brasher, had gone to Pueblo in, I don't know, October, November, and made me a deal that I couldn't refuse to come and be the medical director of his exciting Salud Health Center system here. And it was a different day and age, and the challenge was there, the opportunity to increase that sphere of influence, and there were a lot more patients that we were talking about. So it was a challenge that I was happy to take on and be a part of.
Well, I was kind of looking for somebody, and I happened to be talking one day with Dr. Mark Babbitts from the regional office, the physician at the regional office, and in Denver. And so he said that you better look at Dr. Lacona. Anyway, I got to thinking about it, and I said, you know, I want to see if I can talk you into it.
Salud was very different in 1991, 1992. We had, I think there were 5 of us that were full-time physicians. That's not a lot compared to today when we have 45. And we had probably 8 PAs and nurse practitioners in those days. So it was different than Pueblo because we were so spread out. We had clinics in Longmont then, in Brighton, in Commerce City, in Hudson, in Platteville, and the flagship clinic in Fort Lupton, along with a small site in Frederick. The 90s were a good time in regards to solidification of the movement. I always like to say that the decade of the 70s, it took us just to get started, just to get off the ground, and I think that's very true. In the 80s, we learned a level of sophistication. Some of us continued our education because that's what we needed. Other of us led the health center movement with the positions that we had. And it was the 90s where now we're starting to get a very mature understanding of what it would take financially to make this work long-term and to survive. Because by that time we realized, no, we were not going to replace the existing healthcare system. We were going to be an important player and part in that, but we really had to develop relationships with the greater community. In the 70s, we thought we could go it alone. No, that was not an option. And so my job when I got here was to develop good relationships with the hospitals.